Depression is a very serious problem in the U.S. and in the world. It can cause people to not act like themselves and think negative thoughts. Without treatment or help, it can sometimes lead to suicide. Depression affects all people regardless of age, geographic location, demographic, or social position. In the U.S., 18.8 million American adults, or about 9.5% of the U.S. population, 18 and older in a given year, have depressive disorder. People who may have anxiety may actually suffer depression or vice versa. A recent study sponsored by the World Benefit Organization and the World Bank found unipolar major depression to be the leading cause of disability in the United States. Everyone can be affected by depression. Conceptions of abnormality differ between cultures, and this can have a significant influence on the validity of diagnosis of mutual disorders such as depression. Though many disorders appear to be universal, that is present in all cultures, some abnormalities or disorders are thought to be culturally specific. This is called cultural balance syndrome. The American Psychiatric Association has noticed culture balance syndrome by including a separate listing in the appendix of DSM-IV 1994. Fernando points that many exotic conditions actually occur quite frequently, but as long as they are limited to other cultures, they will not be admitted into the mainstream Western classification. Depression is common in Western culture, but is not as common as it is in China. Asian people tend to live with an extended family, which means that they have ready access to social support. Asian doctors point out that depression is common among Asians, but only need assistance for physical problems and rarely emotional. If emotional, they usually tend their depression by talking to the family. Reporting bias can make cross-cultural comparison difficult. Studies that use diagnostic data is truly based on hospital admissions, which may not reflect the prevalence rates for particular ethnic groups or particular disorders. Due to the low admission rates found in minority ethnic groups may reflect cultural beliefs and mental health. Cohen explains that in India, mentally ill people are cursed and looked down upon. In addition to cultural attitudes, low admissions rates can also reflect a minority group's lack of access to mental health care. Some psychologists believe that it's not just interpretation of diagnostic data, but the real differences exist between cultures and the symptomology of disorders. Marshall reflects that depression takes an emotional form in individual cultures such as America. Collectivist societies that have somatic symptoms such as headaches are dominant. Depressive symptoms patterns differ across cultures due to cultural variations and sources of stress, also of coping with stress. Kleiman argues that it is possible to compare depression cross-culturally because it may be experienced with substantially different symptoms or behavior. Cultural blindness is a big problem of identifying symptoms of psychological disorder if they are not the norm in the clinician's own culture. Coherence and Cochrane and Shashidharan point out that it is commonly assumed that the behaviors of the white population are normative, and that any deviation from this by another ethnic group reveals racial or cultural pathology. How psychologists avoid cultural bias influencing diagnosis. Clinicians make efforts to learn about the culture or the person being assessed. This knowledge can come from professional development consulting with colleges or direct discussions with the individual. Also, the evaluation of the bilingual patients should be undertaken in both languages, preferably by a bilingual clinician or with the help of a trained mental health interpreter.
This is major depressive disorder. It affects 15% of people sometime during their life. During the 1980s, depression accounted for 1/4 of all psychiatric hospital admissions in the UK.
It is 2 to 3 times more common in women than men.
It mainly affects the lower socioeconomic groups. 80% of people will experience a subsequent episode lasting 3 to 4 months. Symptoms are loss of interest and pleasure. Symptoms experienced last at least 2 weeks. Other symptoms are insomnia, appetite disturbances, loss of energy, feeling worthless, suicidal thoughts, and difficulty concentrating. Hi, I am here today with Dr. Brown, who, along with Dr. Harris, are 2 psychologists that perform depression research. Now, it was found that women are 2 to 3 times more likely to become depressed than men, and more likely to experience several episodes of depression throughout their lifetime. Did this factor into your decision to study women in your 1978 research?
Yes, many believe that the reason women are more likely to experience depression is because they are supposedly more emotional. We set out to find the cause of their depression by examining the relationship between social factors and depression.
What did the research consist of?
We looked at 458 women from Camberwell, London, between the ages of 18 and 65 years, who had received hospital treatment or sought a doctor for their depression.
What did you guys find?
We found that 82% had recently experienced at least one severe event of major difficulty, while only 33% of a non-depressed comparison group had. The interesting part, however, was the evidence we found of a pronounced social class effect in married women.
Would you care to elaborate?
Sure. 23% of working class women had been depressed within the past year, compared to only 3% of the middle class women. The working class women who had younger children had a higher risk of depression than those who didn't. Also, among both classes, women who were widowed, divorced, or separated were also shown to have high rates of depression.
Wow, that is very interesting. But were there any faults in the study?
Well, my 20% of women who experienced a stressful life event became seriously depressed, suggesting that people vary in vulnerability to this disorder.
What did this information allow you to conclude?
We were able to conclude that one of the most protecting factors against depression in this study was the presence of a partner.
Thank you very much, Mr. Brown. As you can see, depression affects each gender in its own way. Fortunately, we have scientists such as Mr. Brown and Mr. Harris to help find uniquely tailored treatment in order to better aid those suffering from major depressive disorder.